health problems are one of the factors that play an important role in actualizing quality of human resources. So in the development in the health sector, it is expected that it will be increasing the levels of public health and health services. Tuberculosis or TB is an infectious disease that is still the world's concern. Until now, no country is totally free of TB. The mortality and the morbidity caused by the microbacterium tuberculosis is also high. 5 of countries with the highest incidence of cases are India, Indonesia, China, Philippines, and Pakistan. Based on data in 2017, there are around 420,000 TB cases in Indonesia. WHO defines a high-burden countries for TB based on 3 indicators, namely TB, TB-HIV, and MDR-TB. While Indonesia is being to the 3rd category, which means that Indonesia has the major problems in dealing with TB. One of the efforts to control TB is a drug treatment. However, if a drug treatment of TB patient is inadequate, TB cases can emerge drug-resistant or MDR-TB or multi-drug-resistant tuberculosis. MDR-TB is a TB case with resistance to at least 2 potent types of anti-tuberculosis drugs such as rifampicin and isoniazid. Rifampicin and isoniazid are the backbone of a treatment regimen because the combination of 2 drugs has strong properties as anti-tuberculosis drugs. So, imagine what would happen if TB patients were resistant to these 2 drugs. Therefore, my name is Dwi Asih Ramadhani, the representative from Universitas Muhammadiyah Yogyakarta to Pemilihan Mahasiswa Berprestasi Nasional 2019, and this is my idea for Indonesia. Based on the MDR-TB Global Report in 2010, Indonesia is a country with a burden of MDR-TB number 8 in the world. Infodatin 2016 state that the cases of MDR-TB increase from year to year. And in 2015, MDR-TB cases in Indonesia reach about 50,000 cases. TB control is in point number 3 of the 17 global SDGs, namely good health and welfare. From point number 3, there are several targets and indicators. Target number 3.3 is end the AIDS, TB, malaria, and tropical disease epidemics. One of the factors that causes MDR-TB is patient does not comply with the provision of treatment and the duration of the treatment regularly to achieve healing. Therefore, the main problem that is quite significant is related to the use of anti-tuberculosis drugs that have not been maximized. Compliance in taking medication is very closely related to the role of pharmacists as health workers who have more competence in the field of medicines. In the current era, there has been an expansion of the paradigm in the world of the pharmacy from drug-oriented to patient-oriented. Patient-oriented focusing more on the pharmacy service on the patient recovery, and it can be implemented in pharmaceutical care. The implementation of the pharmaceutical care can be done through the first level of health services, namely Puskesmas. And based on the Minister of the Health Regulation number 74 of 2016, that the health services, as known as the Puskesmas, can cover 2 things. Namely, the first is management of the pharmaceutical preparations and medical materials consumable, and the second is clinical pharmacy services. There have been a number of the government efforts which were made to reduce the number of MDR-TB patients. and based on the Minister of Health Regulation number 67 of 2016 on TB preventions, that the provincial government and the district government of the city must set the regional TB control targets. Thus, efforts are needed to prevent the progressions of the TB patients to MDR TB patients. One of these can be done at the first level healthcare facilities, namely Puskesmas, where the promotive and the preventive efforts can be carried out optimally. To optimize the role of the pharmacist in the public health centers in order to overcome the problem of MDR TB, I initiated the 5-Circle Pharmacy Care program. The 5-Circle Pharmacy Care is a model that redesigned the patient-oriented concept in order to optimize the performance of the pharmacy in public health centers to improve the quality of the health of TB patient and MDR TB patient in Indonesia. This program is an education program in a small groups and monitoring TB drugs as a preventive and curative effort with the regular and continuous meeting schedules. The vision of this program is to become a first-level pharmacy-based services as a preventive and curative effort for MDR TB patient. Preventive is interpreted as an effort to prevent TB patient from becoming MDR TB patient. Curative here is interpreted as an effort to cure the disease, reduce suffering, control the disease and disability. The short-term mission of this program is to deliver drug information services correctly. And the long-term mission of this program is to reduce the mortality and morbidity of patients with MDR TB and improve the quality of life for patients with MDR TB. The subject of this program are pharmacists, while the target or object of this program are TB patients and families of TB patients. The potential of this program are the first, helping TB patients identify their health problems. Second, helping them find problem solving. Third, motivating to recover and having an increase in quality of life. And the last is opportunities to plan the further health program. Steps for implementing the 5-Circle Pharmacy program using PDCA strategy. And the first is plan. Plan is the strategic planning phase, divided into 3 phases. The first is creating the blueprint or the module for implementation, including the program name, vision, mission, subject of the program, object of the program, program implementation phase, and program implementation schedule. And the second is conducting a socialization and the permission request at the Puskesmas, including socialization at the health office, then followed by the selection of the Puskesmas as a trial project of this program. And the third is conducting training to the pharmacists at the public health centers. This training is useful for assessing initial knowledge about tuberculosis and effective in increasing the knowledge for the pharmacists in the Puskesmas. The implementation strategy of the 5-Circle Pharmacy Care are divided into 5 cycles. The first cycle is screening TB patient and TB-MDR patients based on the doctor diagnosis and the history of the patient's medications. And the second is grouping the patient based on the MMAS age. And after the screening patients, TB patients are grouped into 3 groups. The first is ordinary TB patients, and the second is TB patient with possible MDR, and the third is MDR TB patient. And the third cycle is giving materials and motivation about the disease. At the first meeting of the 5-Circle Pharmacy Care program, the material and motivation regarding TB and TB-MDR and will be given to the TB patients and the families of the TB patients conducted by the clinical pharmacists. And the fourth cycles is drug information services and counseling. In this cycle, the drug information services, activities, and counseling are carried out individually, not done in groups. This adheres to the principle of the personalized medicine, where each patient has his own problems which cannot be compared to the other's patients. And the last cycles is monitoring therapy, including the monitoring drug effectiveness and the side effect or the drug's toxicity. Check or strategy evaluations is to evaluate the success of the program from the patient point, puskesmas point, and the successful therapies. Action or follow-up and evaluations is reviewing the result of the check stage to get indicators for the program improvement. If the result of the evaluation turns out to be effective in overcoming MDR TB disease, then the concept of the 5-circle pharmacy care program can apply nationally. Indonesia, let's fight TB!